We're talking about understanding the complexities of gluten sensitivity. I had the opportunity this past weekend to go to Orlando, Florida for the 2011 Neurometabolic Super Conference, 3 days of absolutely jam-packed information that bored half of us and probably would have put you guys into a coma. But the information that we learned was so absolutely amazing. And what I've done is I've taken some tidbits of the leaky gut and gluten and food sensitivity aspects of that seminar. We also dealt with childhood developmental disorders, neurodegenerative disorders like Alzheimer's and Parkinson's. We dealt with autoimmune dysfunction. We dealt with pediatric autism spectrum issues. Just a ton of different topics. But and when we talk about food sensitivities, we're going to talk about gluten sensitivity by itself. We're going to talk about why there's so much of it. And we all know, I mean, you've seen, if you look over the last 5 years, there's been a ton more products. I mean, it's a $4 billion, there's a $4 billion industry now. Udi's is at the top of that industry. I mean, they're leading the way. And, I mean, it's not going to slow down. This is not a fad. I mean, this is not going to stop anytime soon. And there's a reason why you're seeing so many companies sell, you're seeing so many restaurants offering that to people, and you're seeing so many of you diagnosed with these problems. So we're going to talk about why those reasons are there, what the research actually shows about that. I'm going to talk about the difference between gluten sensitivity and celiac disease. That's a big one. We're going to talk about the impact on health. We're going to talk about mortality rates a little bit. I'm going to talk about autoimmune antibodies. A lot of you may have thyroid problems, and we talk about thyroid antibodies leading towards Hashimoto's or Graves. And, those are antibody tests for a specific organ or gland, the thyroid. But we're going to talk about, what research shows when we look at autoimmune, maybe antibody markers for lupus or rheumatoid or, MS or type 1 diabetes, these other conditions as well, and what that does to affect your life. I'm going to talk just a little bit about immunochemistry. I'm not going to bore you too much, but I want to give you guys a breakdown of what gluten actually is, how wheat breaks down, and then how it goes into our body. And we'll talk a little bit, most of you know this, but we'll talk a little bit about some of the lab testing that we do now, the Cyrix laboratories and things of that nature. So when we talk about gluten, just so we're clear, gluten is basically a compound that is in grains. It's in wheat, that's the big one, so you're talking your breads and pastas. It's in spelt, it's in kamut, which is also called Polish wheat, and many of you may have found Polish wheat positive on array number 4. We've talked about some of that with some of you guys, and it's well, I've never eaten it before in my life. Well, I have an answer for why that is, and we'll talk about that in just a minute or so. But gluten also is inside of oats. So, and actually, I will say that's actually not true. Oats by themselves are gluten-free, but in our country, 90%, probably more than that, probably 95% of the oat farms cross-contaminate with wheat when they make their product. So if you look at oats, they have to specifically say gluten-free, or else they're not. And actually, oats happen to cross-react as gluten, and we'll talk about that again later. But so, oats for some people are gluten. Rye and barley, and also malt. That's one I don't have in here, but again, you think of malt liquor, malt beverages, malt. Again, beers. It's that's one of the things that you'll see with gluten. A lot of times, you say, hey, I'm not eating any wheat products. I'm gluten-free. But then soy sauce, okay, that has gluten in it. How about food starches? Okay, if it says modified food starch, that means gluten. And actually, the government's doing a better job of making companies mark what consists of it and what doesn't. You'll see a lot of times it'll say modified cornstarch, or it'll say modified food starch, and then in parentheses, not derived from gluten or derived from corn or potato. And they're trying to do a better job of that. A lot of times, food emulsifiers, food stabilizers, artificial food coloring, again, malt extract, flavoring, syrup, dextrins, so all those, make it very simple. If it's in a vending machine for more, and it has a shelf life of what, more than 3 years, 4 years, 10 years, right? If it's a prepared food, that's in the freezer as a quick dinner, if it's something that's a convenience food, there's a good chance, unfortunately, that it has a hidden source of gluten in it. Beer also has gluten. unless it's made by sorghum, which is a gluten-free grain. And Red Ridge is the biggest one. It's by Budweiser. Obviously, you're going to see that more. But there actually are, I think, like 13. Taco Mac just opened. It's my favorite bar from Atlanta, and they just opened right in Huntersville. They have 6 gluten-free beers on their menu. And there's, again, 13 that are out there. There's one that's German. That's supposed to be the best one that's out there, because a lot of them don't taste, if you like beer, they don't taste very good. But you got to keep in mind, sometimes distilled spirits also, I mean, you think about vodka is made from wheat. Now, you think about, well, not most vodka. Russian vodka is potatoes. The majority of vodka that you see is a grain vodka, which is wheat-based. You're also going to see, obviously, Scotch, whiskey, bourbon, things like that are made from grains. Now, one of the doctors this weekend contacted Maker's Mark a few months ago and said, hey, look, you're advertising on your Facebook page that Maker's Mark, which is a blended whiskey, is gluten-free. Have you run NSA? Have you run a test on it? And she didn't get back to him. So about a week later, he followed up with her again, and she said, no, we haven't. And so they're saying it's gluten-free because they're saying we distill it, so the gluten should be burned off. I'm going to tell you, from my understanding and from what the experts say, if it's triple distilled or more, you're probably safe. So, I mean, keep that in mind. And I can tell you, again, we're not going to talk about alcohol all night long, but this is something you talk about, conveniences and what you can do if you're stuck not eating gluten. There's a new vodka that's out there that's, I think it's called Ciroc, and it's made from grapes, and it tastes like vodka. So, I mean, there are more and more options, and people are, actually, that's Puff Daddies, P. Daddies, and as you think about, there are more and more people that are out there that are going this way towards gluten-free on a mainstream basis. So, it's just something to think about. Okay, so when we talk about wheat's the food, that we're all sensitive to. It breaks down into 2 components, protein and lectins. We talk a lot about lectins because for most of you, I put you through what's called a repair-vite diet, which helps heal your leaky gut. And lectins are ingredients that, the concept is, when we have to soak our beans before we cook them, it's reducing the lectin count. So lectins are these proteins that are in all these foods that we have to break down before our body can digest them. The proteins break down into gluten, and the lectins break down into wheat germ agglutinin. So it's 2 little components. From there, gluten breaks down into 2 additional components. Gliadin, which is the antibody test that's commonly done, alpha-gliadin, and glutenin. Now I can tell you, glutenin, up until about 6 years ago, was thought to be completely okay, until a scientist in France confirmed that no, glutenin also causes inflammation in the gut. And newer research is showing that if you are positive to glutenin, that as well is a key component of gluten sensitivity. Now, gliadin breaks down into 4 different types of gliadins. Alpha-gliadin, again, that's the main one. If you're diagnosed with celiac, that's a traditional test that they look at as an alpha-gliadin panel. Beta-gliadin, gamma-gliadin, and omega-gliadin. So you could be positive to just glutenin, or just omega-gliadin, or just wheat, or wheat germ agglutinin, and negative for alpha-gliadin. So your celiac panel comes back negative, yet you still have gluten sensitivity. When we eat gluten, it gets broken down into those 2 parts, gliadin and glutenin. Gliadin is too big to be absorbed by the intestines, so it gets converted by something called transglutaminase. This is something, if you have a celiac panel, you also may have heard of. Once transglutaminase converts to gliadin, it can be absorbed. But for some reason, some people's bodies see those gliadin food particles as a foreign protein, and basically it attacks, causing inflammation. And that's where we talk about that autoimmune reaction against gluten. So when you have this transglutaminase, there's an enzyme that's made in the intestines that breaks down those 2 parts to it. And it breaks them into what's called deamidated gliadin. This is important because in this country, about 50, 60 years ago, and actually I had an old patient who was a Statesville farmer who actually literally remembered when they changed his wheat seeds. Like, I remember when they changed our seed, and everything was different then. Literally, they started, they being the seed manufacturers, the big companies that provide farming, stuff to the farms, said, hey, we're going to deamidate gliadin, and it's going to allow it to be more water soluble and easier to use and make. And that's why most foods today, come from that deamidated part. It's what's allowed, again, those foods that we have that are packaged in vending machines and everywhere else to have these huge expiration dates. The cheaper the food, the greater the deamidated gliadin content. Now, the Mayo Clinic has just come out and said you should not test for gliadin as celiac disease anymore. You had a gliadin test, probably at one point. They're saying don't test for gliadin, test for deamidated gliadin, because it's the most common form that we have in our country. So if they're saying, change the test to what we're actually eating, it's in everything that's out there. And that's really not good for us. So one more thing with gluten. If you're gluten sensitive, there has to be a genetic component. Okay, and we're going to talk about the genes. Some of you we've run gene panels on, some of you we haven't. You've got that genetic profile. Then you have to have exposure to gluten, which causes your body to react abnormally. With the genetic predisposition, the gene we're talking about is the HLA-DQ-B1 gene. 95% of celiac disease patients have it. Okay, and there's also the DQ8 gene. These two genes, it's another 5%. They estimate that 25 to 40% of the U.S. population has either one of those two genes. That's a pretty big number. Right now, the traditional medical diagnosis of celiac is only estimated at 2 to 4% of the U.S. population. But yet we know that the gene isn't up to 40%. So that number is likely much, much higher. So if you have been found to be gluten sensitive, you have the gene. We no longer have to test for it. I mean, that's basically what this research is showing us. If you come back that you do not show gluten antibodies, then you want to check for the gene, because there's a pretty good chance, 4 out of 10, that you've got, 4 out of 10 that you've got one of those genes. And so if you have that gene, then an exposure to gluten could activate it. And it's something that you want to, especially with children. So if we talk about, you're gluten sensitive, you've got young kids or even teenagers, and it's, hey, and as far as you know that they're fine, they don't eat, they don't have any problems eating anything, test them for the gene, because if they have it, if they keep on that path, the more you eat something, the more the body's, going to say, hey, I don't know about this, and it's probably going to activate at some point. I had a patient that his family was from Middle Asia, India, and his mother would send him over wheat from India, and he would make naan bread and all this great stuff that he did not respond to. And when he moved here, it was like a completely different world. He responds. He's gluten sensitive. He has issues, again, with the gluten that, the wheat that you eat here. You go to Sangam and you have their Indian food, and you can't eat it because they're getting flour locally. They're not importing it. So you asked about food allergy versus reaction versus sensitivity. When we talk about an allergy, we're talking about a severe reaction from the immune system. Commonly, we'll associate that with what's called an IgE reaction. That's going to be instantaneous. It can be life-threatening. Think of a peanut allergy. Think of a shellfish or shrimp allergy. Asthma, immediate shock. That's commonly what's going to happen. Now, what commonly happens is you go to your doctor and you say, I think I have food problems. And they say, go to your allergist and get allergy tested. And the allergy tests are going to come back negative because you do not have an allergy. What you have may not even be a reaction. For some people it is, with the IBS issues or if there's reflux, gas, bloating, if there are GI issues, then it could be a food reaction. What I mean by reaction is it's not that severe, but it's got symptoms. Upset stomach. Think about if you have coffee and you get the jitters afterwards. That's a reaction. How about gastritis? And I hear this a lot from some elderly patients. I had a little bit of gastritis, or diverticulitis. And I took a pill and it went away. That's from a food reaction. That's inflammation in the gut from something you ate, most likely. When we talk about a food sensitivity, you may have absolutely no gut problems at all. What happens is it's silent. There's no detectable symptoms. It's affecting your immune system, but it's not necessarily having a localized effect on your gut. And that's the distinction with that. Now, you can have a food sensitivity that has food reactions. I've got some patients that when we removed foods out of their diet, those sensitivities almost became allergies because of how their immune system was reacting. But at the end of the day, it becomes an issue where we have to identify the food antibodies themselves, and then based on that, make recommendations for what to eat and what not to eat. And based on the type of testing, and again with Cyrix Labs, I'm confident with the level of testing. If it comes back that you show gluten, then that's lifetime. It has to be. And if you don't, again, there could be a risk of that. So we talk about gluten sensitivity versus celiac disease. Okay, that's the next topic. What's the difference? We talk about it. We look at outcomes of gluten sensitivity. You're exposed to gluten, okay? Let's say you have an immune reaction against gluten. Let's say you have no gut issues, okay? What's going to happen is you're going to have tissue inflammation. From there, you're going to have antibodies released. I talk about this at a lot of my workshops. We talk about, maybe an antibody to the gut or to the thyroid, where else can it affect? We're talking about, the myelin. We're talking about the brain, the cerebellum. You're talking about islet cells. We're talking about the pancreas. So you can have tissue autoimmunity where that reaction doesn't affect your gut, but it affects your nerves, it affects your pancreas, it affects your brain. You can also have issues to gluteomorphin. Now, gluteomorphin, I've talked with a lot of you about it. It's kind of like heroin. It's an opiate receptor in your brain that responds to gluten. So some people, when they eat gluten, your body gets high. I mean, and tell me, for those of you who've eaten gluten in the past, and you go to a nice French restaurant or a nice Italian restaurant, and you see that French bread come out, and you drool over it, right? When that happens, that's because your brain is triggering the response to gluten. So if you don't have gut issues, this is the type of response that you're dealing with. So this is what's going on with you. Okay. If you have gut issues, what's going to happen is you may not even have a genotype. You may not have that HLA-DQ gene. So it could be non-celiac gluten enteropathy, basically an intestinal inflammation. If you have the gene, then I don't care what medicine says. If you have the gene and you have gluten sensitivity, you have celiac disease. Right now, the only way to diagnose legally ICD-9 code on an insurance form celiac disease is through small fiber biopsy. They have to go in, do a colonoscopy, and actually check and pull out and see what's there. And the reality is that's going to change because research shows that you don't need to do that. The effects are the exact same. If you have the gene and you have sensitivity, there's no discernible difference in your body.
Stand up again.
Sometimes, yeah. And again, that's where we get into the leaky gut issues. Oh, what? Yeah, here we go. So what happens in your intestines, you've got these little hairs, the little villi. They help move food along. And when you have damage, this is pretty good because you can see, if you look at this one right here, you see how there's only like 3 strands. And then 6 months later, you see how solid it is again. So that's exactly what happens.
Have the biopsy done, and you've been on a gluten-free diet.
It may be negative.
Thank you. That's the point.
Yeah, you're exactly right. You may show negative for medically diagnosed celiac disease.
I'm hot and mad about it. I am. I've got celiac. I don't care what the heck they say.
I can tell you there are, again, there are probably 15,000 doctors out there that utilize Apex products, which is actually, that's the number I just heard from Dr. Karazian, which most of you know that's one of the main supplement lines I use. And Dr. Karazian is on the cutting edge of all the metabolic, autoimmune, and thyroid research that's out there. Those 15,000 doctors are a large piece of what the 200,000. I mean, that's pretty significant. I mean, you're talking, 5-10% of all the providers that are out there, not just chiropractors, medical doctors, nurses, osteopaths, everyone. That's a number that's going to grow, and you're going to see medicine changing. You're going to see diagnoses. They're going to have to change because, again, every bit of research that's out there is showing what we know in our office and what your medical doctors think is voodoo. I mean, again, you've probably heard that as well. There's no way you have gluten issues. It's in your head. So one of the studies, this was done 4 years ago. This is actually pretty neat. It was done in a psychiatry journal. Gluten sensitivity as a neurological illness. It said patients with a disease of the intestinal tract, so we're talking celiac disease, represent only 1/3 of patients with neurological manifestations and gluten sensitivity. What that means is 66% of people out there have no gut symptoms. Again, that same issue. And this study actually was first really important because the Psychiatry Association labeled gluten sensitivity as a neurological illness because of how much it can affect the brain. You know, and of course, the fact that most people who have gluten sensitivity don't have gut issues is even scarier, because how many people, there's a study, I don't have it here, but I've had it presented to me. There are 4 cases published in PubMed, you know, the Library of Congress of Medical Research, showing gluten-associated or confused ALS. Basically, you know, amyotrophic lateral sclerosis, you know, Lou Gehrig's disease, which is incurable. There are 4 published cases now where they said it was actually reversed because they found it was gluten, they got them off, and they were able to stop the symptoms. The scary thing about that is I've seen a few patients come through my office that we've treated who have family members who've had ALS. And my patients have had gluten issues. So you really wonder, you know, could there have been something done? Oh yeah, sure. Yeah, no, absolutely. I mean, well, I mean, think about it. Again, gluten, gluteomorphin. You know, you're drinking beer all day long. I mean, sure. Yeah, absolutely. So again, 2/3 of the population with gluten sensitivity has no symptoms. They have other problems. When we talk about symptoms with celiac disease, only 12.5% again have symptoms. This kind of have you ever seen that picture of, you know, the tip of the iceberg, and it shows the iceberg, the huge iceberg underneath the water? That huge iceberg under the water is the majority of people. They are positive for the genotype. They are positive upon tissue biopsy. They are celiac disease in the traditional sense, but they have no symptoms. So again, this is a study that showed that most celiac disease patients don't have gut issues. For every symptomatic patient, it's 1 in 10, or 1 in 8, excuse me. For every symptomatic patient with celiac disease, there are 8 patients who have no GI symptoms. Again, these stats, you know, they're within the last 10 years. I mean, these are the medical journals that are out there, and so this is ammunition. If you ever go to your GI doctor, and you know, and I forget who it was, they want to convince you, you know, they want to say, I want to convince you that, you know, you have to do this. It's not working. Bring them these stats. Yeah, that's right. It was you, Val. Bring them these stats. Say, hey, have you read this research? Do you read? You know, and I'm sure they'll be real happy to see that. But
I still believe in fairies. You're not getting better. Like, my hair is growing back. What do you think?
So why is there so much gluten sensitivity now? What happened? Okay. A couple theories. Is it being better diagnosed? Today it is, but not over the last 50 years. In fact, the research we have now, the studies that we have now, CRX has only been open since February of this year. NTRL Lab's only been around for a few years, and that had improved sensitivity testing through stool. So, I mean, that's one theory, you know, and how about the grain is actually different? We talked about that. That is, in fact, true. There is a difference in that deaminated gluten. They will not call it GMO, genetically modified, in our country. We don't use that term. It is. I mean, that's exactly what it is. They're changing the content of the grain. In Europe, it's banned. They can't do that.
Are there people who suffer when her daughter, who was born in 1918, was sick?
I will be completely honest. My thought process is if it's somebody who passed away prior to 1950, the chances of it being from a change in diet are probably not as much. It could have been a genetic link that could have been there. I mean, again, you know, people have had celiac disease, you know, a small percentage for as long as they've kept stats, but it's definitely, it wouldn't be associated with, you know, this changes in the grains and the genetic modification. So how about
to be associated with other foods?
Sure. I mean, it's probably, yeah, sure, absolutely. So, okay, you know, research has shown that the prevalence of celiac disease has increased dramatically, not just because of increased detection. And again, like I said, the tests that we have now are only a couple years old. There's a study that was done in, this is a big hallmark study, and I'm going to give you just a little tidbit about it that shows that there's an increase due to something else other than detection. And of course, undiagnosed celiac disease may be associated with increased mortality. This is another big one. So when we talk about increased prevalence of undiagnosed celiac disease, what they did is they looked at the long-term outcomes of celiac disease in diagnosed people and undiagnosed people over the past 50 years. It was an Air Force study. 9,000 healthy young adults at Warren Air Force Base from 1948 to 1954. And then they took almost 13,000 gender-matched subjects from elsewhere. What they saw was the amount of undiagnosed celiac disease between the Air Force and the other ones was, you know, and the traditional people were compared, and undiagnosed celiac disease increased dramatically. I mean, they're talking, what was it? It was, I think the stats, I've got the article back in my office. It was something like 600%. I mean, it was a dramatic increase in celiac disease. And this is, again, these are medical tests. These are traditional tests. What caused it? that's what we're looking at, is it's there, and there's only so many things that can affect it. During 45 years of follow-up, they also found that undiagnosed celiac disease was associated with nearly 4-fold increased risk of death. So if you have gluten sensitivity and you don't find out about it, you have a 400% chance of dying better than somebody else who doesn't have it. That's scary. In the past 50 years, celiac disease went from 1 in 700 to 1 in 100. And those with the greatest mortality rate, again, were ones who had silent celiac disease who didn't know it. So what causes an increase in gluten sensitivity? GMO foods, the genetic modification, deamidation. How about our grains, on average, are about 2 years old when they get to the grocery store. So they're sitting in a silo for these long periods of time, and enterotoxins, bacteria, get on them and contaminate them. And it gets better because the grain comes to you, and so you know what they do? They stick it full of preservatives so it tastes fresh. How fun is that? How about leaky gut syndrome? Again, that's a big, big thing, seeing an increase. So you've got this intestinal permeability, your gut is inflamed, it's causing symptoms, and it's making you more prone to be sensitive to what you eat.
I thought the gluten caused the gut.
It can go both ways. It can go both ways. And again, we talked about, do you have a genetic issue? Do you not? I mean, and again, you have that gene. If you have gluten sensitivity, for the most part, you have that gene that's there, but it's not activated until some sort of exposure to gluten is triggered. Sometimes that exposure won't get triggered unless you have all these other foods that break your gut down, or infections that break your gut down, or you have an accident and you get scared the heck out of you, and some stressor happens, and then that stressor causes the gluten sensitivity, that gene to kind of get turned on. Poor nutrition. I mean, again, it's a number of patients we see who, they eat at McDonald's for lunch, Cracker Barrel for dinner, and maybe Hardee's for breakfast, right? I mean, it's breakfast food is not a chicken biscuit, or how about Apple Jacks? I mean we're trained, cereal, right? Or even Honey Nut Cheerios, right? You might as well take donuts, dump them in milk, and you're eating the same thing. Enzymes. So this is something that we see with some patients as well, where you have decreased digestive enzymes. And that enzyme insufficiency also leads to the increased prevalence of food sensitivities.
Does that ever get fixed over time?
Just like acid imbalances, it can be corrected. Sometimes, depending on the damage that's there, you have to constantly support it to keep it corrected. I've seen both ways go with that. I want to go over just another quick 2 studies out there, and then we're almost done. Associated autoimmune antibodies are frequent in celiac disease and their first-degree relatives. Those include high amounts of antibodies against thyroid and pancreas. Obviously, we've talked a lot about thyroid and gluten. That's a big thing with my practice because of the link in antibodies there. How about anti-gastric and liver antibodies? How about smooth muscle antibodies? How about anti-brain, anti-cerebellar antibodies? And how about anti-bone and joint? What we're talking about is RA, MS, SLE, Crohn's disease, hepatitis. I mean, these are the kind of things that we're talking about here that are associated with gluten sensitivity. And again, the psychiatric illness it's actually one of the main causes of disability in undiagnosed adult celiac disease. So one of the newest studies that I was shown this weekend, it was a study produced in a medical journal. I think the date on it was 2008. It's the Mosaic of Autoimmunity: Prediction, Autoantibodies, and Therapy in Autoimmune Diseases. Predictive value of antibodies is what we're looking at here. So, again, a patient comes in, and you have no symptoms in your gut, and we say, hey, but you have this gluten issue. How big of a deal is it for you? And that's what this study kind of covers. What does that mean? What we showed was, the article says there's a new piece of the Mosaic of Autoimmunity that's emerged, namely the predictive value of antibodies. Basically, antibodies have always been used to help find diseases, but they've realized that it does an even better job of determining future diseases in an asymptomatic patient. Many antibodies can be detected in the preclinical or subclinical phase of autoimmune diseases many years before the disease becomes apparent. So they have a highly predictive value. What that means is if I find antibodies in a kid, in your child, they're going to have a disease down the road. The research shows it. They will have problems if they eat that food. You know, and again, it's not just, obviously, we're not just looking at food antibodies. You know, any antibody, if they don't do something to reduce the immune response, they're going to have issues with that. How long? Could be as many as 14 years. Could be as few as 3 or 4. And again, some of the studies I've seen, that 14 years was with rheumatoid arthritis specifically. So the appearance of antibodies for RA can be seen as many as 14 years before the patients develop symptoms. And with things like Hashimoto's, Addison's disease, which is adrenal hyperadrenalism, not like cortisol imbalances from a functional point of view, but almost think like adrenal cancer. Type 1 diabetes, celiac disease, Crohn's disease, it's been shown to have the same predictive value. So again, if we identify antibodies in these organs, we can find them years before the disease causes symptoms. Dr. Tom O'Brien, thedoctor.com, he's one of the foremost experts on gluten sensitivity in our country, was quoted as saying that if you have Hashimoto's antibodies, and again, I forget the article he pulled the research from, but if you have any predictive antibodies for the thyroid, you either have Hashimoto's or you would develop it within 7 years. That's kind of what we're talking about. I mean, that's the kind of research we're seeing here. So, you know, medicine says you have to be at 20 or 40 to have thyroid autoimmune or thyroiditis. But research shows that any value, it's going to come. So, I mean, who wants to wait?
20 or 40, what value?
Like TPO antibody, you know, or TBG antibody, which, you know, when we looked at the thyroid antibody panel and we saw, you know, what are the antibodies that are there. Some of, you know, we've seen 5, 7, 10, 15. You know, any antibody, maybe below the medical value, it doesn't matter. The disease is going to happen. With autoimmunity, and most of you know this, it's a piece of the puzzle. You know, I mean, stress plays a huge role, right? I mean, you know, so stress can play a role in it. Then if you change your diet and you don't fix your stress, and I mean, there are a lot of patients who don't treat with me and they say, I'm just going to make changes to my diet. And then we follow up with them 6 months later and they're doing better, but they're still not where they want to be because there's other things that are there, blood sugar, you know, gut dysfunction, leaky gut issues. How about brain function, anemia, lipids, you know, the thyroid imbalance, everything else that's still there that doesn't get fully corrected by food alone.
Dysfunctional relationships.
Sure, stressors, absolutely. So again, one last article, this is the last research article I'm going to give you guys, mortality rates in celiac disease specifically. The key points here is if you have celiac disease, the mortality rates, that's your risk of death, are increased compared to the general population. It's mainly due to the progression of malignancies, cancers or pathologies that develop out of that celiac disease. And they're greater in the first year after diagnosis versus over time. So if you don't cut out gluten, that first year that you're diagnosed with the gluten problem, you have the greatest chance of death than you will down the road. Early diagnosis in a strict gluten-free diet are protective. So keep that in mind. If we find it and we get it out, then all these mortality rates go out the window. That's what the study shows. That's good for all of us. So currently the labs only test for gliadin, that alpha-gliadin antibody test. They miss reactions to glutenin. They miss reactions to all the other components of gliadin. And of course, you know, so many people have been told, you know, you're fine, you don't have a gluten issue. And, you know, but they aren't looking at all the different components of it. So you have to. Obviously, we use Cyrix Laboratories. I've talked with pretty much everybody here about that, so I'm not going to go over this too much. But I do want to let you know, in talking with Dr. Vajani this weekend, Dr. Ari Vajani is the medical director of Cyrix Laboratories, again, #1 immunologist in the world, you know, brilliant, brilliant gentleman. They have a screening test. If you are asymptomatic, okay, and there are no gluten issues at all, he thinks that if you do the saliva screening test through Cyrix Labs, that may be enough. So for kids, okay, this is for family members. If there's no issues there, run that test alone. If it comes back negative, you don't need to do anything. Consider it negative for the time being. And again, the predictive value ultimately on gene testing says, hey, what's the future going to hold? But when we talk about, you know, the blood test, you know, $300 test versus a $100 test, it's a great way to go. Now, if you run that test and it comes back negative and there are symptoms, which every single one of you has, then the test means nothing. You have to go and you have to look closer because it only looks at alpha-gliadin transglutaminase, you know, those two components. So you have to look at the rest of gluten to see what's an issue. But this is also exciting. The gluten cross-reactivity panel, and again, this goes back to that whole the Kamet or Polish wheat thing that a lot of us have found. If you have Polish wheat or Kamet come up positive, you're gluten sensitive. That's what that means. You don't even need to run array 3. So for some patients, we're starting with array 4 and array 2, leaky gut, and cross-reactivity. And if you show up that you have those markers, we don't even have to run the actual gluten test because we know that you have a gluten sensitivity, which is kind of nice because it saves, again, it saves the patients money. Now, again, for some people, we want to run the test. We want to confirm the severity of it and look at autoimmune issues, so that's there. But, array 4 looks at cross-reactivity. What that means is the amino acids to the food, like dairy, okay, or oats or coffee, are the exact same as gluten in a cross-reactive case. So when you eat the food, your body thinks you're eating gluten. What we're looking at is these top 3 rows are the cross-reactive ones: dairy, coffee, rye, barley, spelt, oats, and yeast. Now, not everybody has cross-reactivity with those. So again, it can be something that can be triggered, turned on because of leaky gut or genetic issues. Good news is if you're not sensitive to corn, you're not sensitive to corn. Okay, I mean that's some of the stuff also. If it comes back with array 4 that it comes negative, then these foods theoretically are safe for you to eat. Now, again, Dr. Vajani's personal story, his wife and son have gluten sensitivity, and they had it diagnosed 2 years prior to him kind of going through the family. He said, "Oh, you have it." He got tested, and he said, "You know what? It came back clean. He didn't have a single marker, no array 3, no array 4, nothing at all." And so he said, "All right, fine, good. I can eat it, and I'm safe." And I forget the health one he had. It may have been like sleep apnea. There's some issue that he had. Snoring. Who knows what it was, right? But there's some significant health issue he had that was continuing. And his wife kind of said, "Hey, well, just come on. You're like the biggest immunologist out there. This is your stuff." It came back negative, but why don't you try it anyway? He went gluten-free, and it stopped. So I will tell you, sometimes the test isn't enough. And he does not know the mechanism. Again, if he doesn't know it, we don't know it yet. I'm sure we will at some point. But there is a possibility. So sometimes doing an elimination diet is a way to go for people. And again, that Serix Labs array number 4 is the one that tests for antibodies. So how many of you don't know about gluten flam? Anybody? You two probably, but everybody else? Okay. Gluten flam is an enzyme that we offer. There's a couple different brands out there. Gluten flam's nice because it also has some botanicals in it that help heal the inflammation in the gut, but it has what's called DPP4. And what that is it basically destroys the gluten and or dairy, and supposedly even soy. I've heard this as well from some of the research. So if you eat it and you take it with the food, then it's going to help offset or prevent that reaction. So it is not a get-out-of-jail-free card. But what it is if you accidentally have that exposure, or let's say there is something that just, you can't help yourself, or, it's your best friend, you haven't seen him in 10 years, and you want to go on, whatever the case is, takes 4 to 6 of the pills, and you have a very good chance of not having a significant reaction from it. Careful using digestive enzymes. This is something, again, looking in the research that's coming up. Heavy doses of pancreatic enzymes are not suggested. They can actually do the exact opposite. They can degrade the intestinal wall. So too much can be bad as well. I've got at least one patient right now that has been doing enzymes for years, and none of the enzymes that I've given her respond well, and she's got this old enzyme that seems to do okay. But I think in general, that's what's happened. Her wall is just so damaged that any enzyme is too much for her. So if you're trying gluten-free, if you have a confirmed gluten sensitivity, never eat gluten again. It's that simple. And if the research that's there doesn't lead you down that path, then we got to look at your brain. And most of you, we are. We're making sure that's working right too. Slipping every once in a while results in an increased inflammatory response. That response can last 3 to 6 months. And it'll probably make you feel worse. Not everybody. It may even make you feel better because of that gluteomorphin response. Antibodies can be found in the blood. If we remove it, we say, all right, right now today you're going gluten-free. 6 months from now, you still have antibodies in your system. So, again, you got to make sure that you really stay gone long term. Of course, we all know about the fat-free craze. Low fat equals increased sugar, though. When we talk about gluten-free foods, this is kind of the thing. A lot of the unhealthiest foods that are out there are gluten-free for two reasons. Number one, if you're eating gluten-free and you're not changing your lifestyle otherwise, you're not getting enough vegetables, which means you're not getting enough vitamins and fortified minerals that are in the gluten products that are out there. So if you go gluten-free, don't just replace your pasta with the gluten-free pasta. You really need to change your lifestyle and eat healthier. But number two, it's all the sugars. It's everything else. And like I said, I forget who I told this to earlier. Everyone deserves a gluten-free cookie, just not 10. And it's an issue where, in moderation, this industry that's out there that, it's horrible for you, it's not any worse than, a scone at Starbucks, right? I mean, it's all, from a fat content, it's all the same. Yeah. So 4 main reasons why a gluten-free diet may not be effective for you. Hidden exposure. And again, you think you're gluten-free, but you're getting it from something. You're gluten-free, but you're eating a ton of corn chips now syndrome. It's peptide cross-reactivity. You may have a corn reaction that's occurring, and that's what that array 4 shows us. Leaky gut issues that are unresolved. And how about other autoimmune or metabolic problems? Again, we talk about the adrenals, sugar, hormones, anemia, thyroid, all these other issues that are there. And like I said before, there is a very big chance, actually I didn't say this, but story. A good buddy of mine practices in Maine, and he's an Ironman, he's a triathlete. And he went to Chile with another friend of his. I've told a couple of you this story before. They're both gluten sensitive. They're both doctors just like me, practice very similar in different parts of the country. When they went to Chile, they said, you know what, we're going to another country, we heard it's okay. Heck, we're going to eat whatever we want. And my buddy Jeff had, wheat products, everything you can imagine. He didn't care. He ate whatever he wanted, and he felt great. He did really well. He did good on his, his Ironman competition, everything. But his buddy was sick as a dog from the first time he ate food there. It was horrible. And what we're looking at with this story is, why does one person react more than another person? We don't have a scientific answer for that yet. The theory is different exposure limits. And that's what I'm hoping to see down the road, is that for some people, any exposure may be bad, but for other people, having it once a week, once we identify, if a test ever comes out with the baseline, then you're good to go. Maybe even, a tiny little bit a day, who knows? I mean, it's obviously science will determine how accurate we can get with that. The only safe answer right now is if you're gluten sensitive, you got to say no. But I really do believe that science, come on, they've come up with cures for everything else, right? I mean, they got to figure something out, and maybe they'll change the food back to the way it should be, and that'll stop the reaction. Who knows?